Good morning. Oh, good. Wow. This is much easier than teaching. Welcome, and welcome to Envisioning the Future of Health Professions Education workshop. I'm Susan Scrimshaw, and I'm co-chair of the forum that is sponsoring this workshop. And it's hard to believe that it's 5 years since the Lancet report on health professions education for the 21st century emerged. And I was privileged to be a member of the Lancet Commission. And I'm delighted to see the impact because those of us on the commission had many debates about what to include. And some of us wanted to include many more of the health professions than made it into the report. But the time that we had, the funding and the size of the report limited us. And we kept saying the work will be picked up, that if we get this started, the work will be picked up. And I'm absolutely delighted that the IOM Forum is continuing that work through a series of workshops and studies. And Afaf, where's Afaf? Afaf was on the commission with me. We were the troublemakers, weren't we, Afaf? Partly because we didn't come from as traditional professions as many of the other members, which is a nice way of saying we're not physicians. But Afaf also was really the driving force for the creation of this forum and was co-chair of it immediately preceding Malcolm and me. So thank you, Afaf, for being here today. So we reluctantly stopped at only 3 of the health professions. And we knew there was much more needed on health systems, the rest of what I call the formal health professions, the non-formal health systems, such as traditional healers, traditional midwives, and others, who are very important in many parts of the world, including parts of this country and the healthcare, and also social determinants of health. And those were only some of the things that we anticipated. We did not fully anticipate the pace of change in healthcare delivery and the economic pressures. We discussed rapid changes in technology and its impact on health professions education and on the work of health professionals. But that subject also remained to be developed, and the changes have been much more rapid than we anticipated. We discussed pandemics, but we could not imagine the destruction of healthcare systems and the loss of health professionals, which occurred in Sierra Leone, Liberia, and Guinea as a result of Ebola. So as we spend the next 2 days envisioning the future of health professions education, we do so with a background of all of the challenges and considerations that I've just mentioned. And yesterday, the forum members discussed a very major challenge, one that some referred to as a chasm, and that is the increasing gap between what we are teaching healthcare professionals and what the healthcare delivery system and social and economic environments look like. We're literally preparing people for a system that no longer exists. And it's a system that has changed, excuse me, and is changing far more rapidly than the context of health professions education. That's our challenge. What people are learning to do may not be relevant even by the time they graduate. And what will health and medical systems be like in 10, 20, 30 years? Yesterday, somebody said some of the health professionals we're educating now may be practicing for 50 years. What is health going to look like in health systems 50 years from now? And how will these health professionals adapt? So the health professionals we're educating today will need to be prepared for a future which may be very different. And we also have a challenge to work with existing health professionals to bring them into the world that has changed tremendously since their educational experience. So the purpose of this workshop, as outlined in the materials that you've received, should take us deeply into consideration of these issues and how to address them. So you, the participants, are here because of your expertise, your wisdom, your experience, and I'm very much looking forward to our discussions. Thank you. And it's now my pleasure to introduce Chris Olson and Beth Mancini, who are co-chairs of this workshop.